stand is read. Do you know, Dan, if we received any notices for public comment at this point? Dan, did we
No,
get
those
any?
wouldn't come to us.
Okay, well, I did not get notified of any public comment requests. Okay. So I think we'll just move on into the agenda, and we have invited today the R1 Regional Planning Association to present to us. Basically, I don't know if both of you are doing it, Michael Dunn Jr. and Jason, or is this primarily Jason Holcomb going to present? Am I correct, Jason?
I will be co-presenting.
Co-presenting, very good. So I'll just let you begin.
All right, thank you. I'm going to do a screen share if that's okay. We have a presentation. So please just notify us if you're not seeing that for some reason.
Dick is coming on. Okay. Thank you, Dick.
Would you like us to wait, Marianne?
Well, Dick came on, so I think, you know, Jay will join us as soon as possible, but I think that we have such a healthy agenda today that I think it's best if you move ahead.
Very good. Well, I will let Michael get us started, and feel free to.
And thank you for having us at your meeting. And congratulations again on the success in getting this all started. You know, I was approached by Ms. Abadi on, you know, what sort of services could we offer all of you as you get this program started. And I explained kind of the best way to share why we could help you, even though we don't have experience with mental health, is our past results. Past results where we created an environment and a governance platform and a group of skilled subject matter experts in-house to be able to provide you know, outside technical support for a number of governments in the region on specific issues. And with Jason coming to join us in his past experience and expertise, I felt like the discussion I had with Ms. Abadi would allow us to provide you staff support as you account for everybody's or the community's tax money and how to distribute it for need. We as an organization, and I don't know if you could switch to the next slide, Jason, yep. Thank you. We as an organization have a strong record in creating criteria for program selection and for expending federal and state funds towards infrastructure, housing, and criminal justice programs. And we most recently, our success was with the census. We received $1 million for the 2020 census and distributed $680,000 as subawards, and did an RFP, evaluated a lot of proposals, scored them, and presented them for review to the governing body to award. And so much so that because the census is delayed, we did such a phenomenal job. Governor Pritzker, without us even asking, without us even knowing about it, we just found out this week, we received another $400,000 for the delay of the census to immediately put that $400,000 to work over 5 counties. Nobody here had ever done the census. We tasked Ivy Hood, who's very capable, extremely intelligent, out of Rockford University. We were lucky to have her. We tasked her with running this program since January. And so what we're about is, whether it's WinGIS, which you'll see on the slide, our economic development district that works with the EDA, our research function, and our criminal justice function, and then our land bank function, where we got involved in land banks over 4 counties. We are used to reporting to the elected board. We are a government entity. We're used to IGA issues. We're used to fiscal agency issues. And we are very good at retaining our staff and bringing on, like Jason, really, really intelligent staff to provide technical support to government that can't find the funding or the wherewithal to bring in FTEs on their own. An FTE that a city or county both might want, we can house that here, and the city and county can use that on demand and share the cost of it. And so that's, I can get in, and I don't want to waste your time with what we are as a governance platform for the mayors and the chairman, some of the other good work we did. I'd rather answer your questions, but at the end of the day, we are government. We're Switzerland. We are equally governed by a number of mayors and chairmen. That's what made the land bank a success, and why the state of Illinois wanted us to have the land bank is we're neutral ground. And we keep the politics. I am the political firewall. We keep the politics away from our staff, so people like Jason can shine and do very well and get to the actual subject matter and get to the actual good work that the community needs. And so I'm happy to answer questions at the end of the presentation about what we are as an organization. We're subject to Open Meetings Act and FOIA, and we're roughly a staff of 25 people. But when Misabati came to us with the idea that we would provide you all technical support, both in day-to-day, week-to-week research, but also in dealing with all the funding requests that you will be getting and creating a fair and transparent process, and using criteria that you as the board would adopt, and helping you set that criteria and then awarding those funds. We felt that we have a phenomenal track record locally doing that in other areas, and combined with Jason's background, we could be that resource for all of you. With that, I'll hand it over to Jason.
So briefly, in looking at some of the other communities throughout the state of Illinois who have mental health boards or mental health authorities, and looking at not only best practices, but also some of these best practices are actually mandates through the Community Mental Health Act. But what we've identified are some key bullets in terms of what are best practices and mandates that would likely be the roadmap or framework through which the Winnebago County Mental Health Board, I'm sure, would also like to operate. And that would include open meetings, assessing the needs of the community, inviting input from especially consumers and families, but other public, open public input, especially from consumers, people who are actually using the mental health system. Responding to the emerging needs of the community as it relates to mental health. Working with legislators, having a feedback loop with local and state legislators to let them know what our community needs are related to mental health, but also to be aware of what type of policy agendas and things are coming down the pipeline that might be good for our community to be aware of and leverage. Providing briefings and reports, certainly I'm sure that's something that will need to be done with some regular degree of frequency to the county board, to the mental health board, and potentially other, certainly the public as well. Strategic planning, which I understand is mandated by the Community Mental Health Act, to be done for a 3-year plan, and also for that 3-year plan to be evaluated and updated annually. Coordinating funding. So one of the things with the funding is that there's a number of agencies that already have funding sources. And so making sure that the funding matches up in a way that the funding is not supplanting any other public funds, but that it's being used in the proper way that it's meant to be used, and complementing existing services, but not supplanting public funds. And then ultimately on the back end of all of that is evaluating the results and being informed by those evaluations to continuously improve the system of mental health in our community. So taking these best practices, I see 6 core functions that I believe would be necessary to execute these in our community. I think number 1 is having some general leadership, having a point of contact, a liaison to the general public, to the county board, and to other relevant committees and bodies that the mental health board would like to have representation on. Somebody with subject matter expertise, I'm sure, would be important to you in mental health, and also having some experience in program management, budget preparation. I think those are going to be key components of what the work that you all are doing. In terms of strategic planning, those 3-year and 12-month follow-ups, starting with a community needs assessment, the data collection to assess the current system. Where are the gaps in the system? Where is there room for improvement? Where are there opportunities? Group facilitation in terms of the network of partners, participation in the planning process, engaging service providers in the planning to improve the service delivery system, and also engaging residents, particularly again with an emphasis on people who are using the mental health system, people who have mental health, have experienced mental health issues. On the implementation side, looking at other communities, there are a number of different types of funding models with public mental health funds, including paying for a position, fee for service, paying for performance, which is a newer model in healthcare in general, and also traditional grant making. For any 4 of these types of funding models, there's going to be an RFP process that's going to be needed, and including a selection criteria and potentially a selection committee, or at least review and recommendations to the board. Certainly consulting with those provider agencies to ensure that you're getting the highest quality proposals that are coming in, being able to provide that technical assistance ahead of time to answer questions and help the service providers understand all of the technical components of the RFP. In some cases, there might be the need for new program development where you're not getting all of the types of proposals that fill all of the community gaps. You might wish to work with some community providers to encourage the development of new programming. And there's also an opportunity to maximize the current funding that's coming through the tax to use that to leverage additional dollars to our community through grant writing. After the implementation phase, of course, there's going to be the need for evaluation. I think a core component of that is going to be standardization of the measurement and the instruments that are used, and providing technical assistance to the service providers so that there is uniformity across the board in the evaluation components. Some of the nonprofits and other bodies that may be applying for funding are probably going to be small in some cases and may not have staff on board that have evaluation experience, and will likely need some support along the way to ensure that from the beginning, everything is being measured in a uniform manner. And then ultimately taking that information, analyzing and synthesizing the data and disseminating that through various reporting, which kind of segues into some of these reporting components. Again, compiling, publishing reports, taking that data, sharing success stories with the community, letting them know and be engaged in this process throughout the entire process, being transparent and really highlighting those areas where we've seen success. And then there's just some back office operation things that are going to be needed. Accounting, auditing, human resources, liability professional services, having a system for Open Meetings Act so that there's never an issue. And we have a very talented administrative staff here who can support some of those functions as well. So just briefly to tell you a little bit about myself, I'm the Community Health Coordinator at the Region 1 Planning Council. If you choose to use the Region 1 Planning Council, I will be the lead person for this project. I have more than 10 years of experience with working with adults and children with mental illness directly. About 3 of those years were in community mental health, and I also worked in a private law firm representing children and adults in disability cases, particularly specializing in adults and children with serious mental illness. I've done crisis intervention, outreach, case management, and advocacy. I also have had the great opportunity to work for Transform Rockford for a couple of years and did some community development and regional planning with them. Most recently facilitated a group of about 20 plus stakeholder mental health providers who have been working together to develop a plan for children's mental health system of care. So that's an ongoing process. Certainly that might feed into the work that you all are doing. Educationally, bachelor's degree in sociology from Wheaton College with an emphasis on social justice and inequality, and a master's degree in social work from Indiana University with a concentration in an advanced generalist concentration. A few of my specialties are collective impact, social innovation, strategic planning, program and project development, community engagement, and mental, behavioral, and developmental health. And I'm going to turn it back over to Michael. Again, happy to answer more questions about those components as we get to the end of this, but let Michael highlight some of the specialties of the Planning Council.
Sure, and I probably front-loaded it in my introduction, but to support everything we just heard, it provoked a few things for me to mention. And that is, Jason, we're very glad to have him. He's going to complement some of the other healthcare initiatives that we were looking to get more involved in over the last few years. We have been involved in community surveys with the Rockford Regional Health Council, but under this COVID backdrop, we've been asked by Chicago, the state of Illinois, your local government here to, as a organization, a regional planning council is an organization that any community in America has if there are 200,000 people or more. So we are a common organization, whether you go to Houston, San Antonio, Seattle, Washington, D.C., there is a regional planning council. And as an industry nationwide, the call went out prior to COVID, but certainly after COVID, that healthcare infrastructure is one of your most critical infrastructures, as much as water, wastewater, and road. And as regional planning councils, we must be much better with our data and our reporting out to local government on what the community's healthcare infrastructure is. And that was the catalyst bringing Jason aboard. And so we really value this opportunity to be able to align with all the work that your board is planning to conduct. But with Jason comes 25 other staff members. So a relationship with us isn't just Jason, it's Jason plus 25 other individuals that are dealing with human service transportation mobility issues, environmental justice, transportation planning, future land use planning, housing planning, and it is a way to embed the planning that we would like to conduct, and I'm sure you would like to conduct, into the overall planning ecosystem that has been going on. And it is a way to elevate that discussion, and it is also a way, since we are owned by Winnebago County, we are owned by the city of Rockford and the city of West Park. We have 10 owners, right? And I report to them. It is a way for Jason to directly report out to them quarterly on the work that he's doing. So by partnering with us, you now have staff here reporting out to the elected leadership on the good work that everyone is doing on this behalf. And it is a way to redundantly keep this on the forefront of the elected leadership's mind and to connect it with some of the other initiatives that are going on in the community. So you can truly look at the symbiotic nature, but look at it holistically. So, you know, I've rattled off the other things we've been involved in, and I'm happy to go into detail, but I think this would allow you guys to hit the ground running. It would allow this money to be spent wisely, quickly, as it's received, for the tremendous, and I can say that personally, in my own family, with the tremendous need that is out there. I'll let you finish.
Yeah, so just a few kind of summarizing points. You know, the Regional Planning Council, because of the way that we have the staff arranged, it kind of provides this office in a box type of setup where we can really get going pretty quickly if that's what your need is. And certainly with me being the lead person, but being able to utilize other staff as needed and being able to build that on an hourly basis. So you have a staff team, but you're not paying for multiple full-time staff and can really just only utilize the hours that you need for the services that you're requesting. And we have the flexibility as well to scale up and scale down hours as needed. So you might have certain months that need more because it's a strategic planning month and you have that plan due, and then there might be down times where there's less need. So I think that additional flexibility certainly will hopefully lower the cost of administration and ultimately increase the amount of dollars that can be put into direct service, which I think is what we would all like to see happen. So next steps, if you wish to take the next step, from my perspective, I think we need to define the process in terms of all these components of what we want to do. How does that look? And in terms of a timeline, and then finalize a service agreement between the Mental Health Board and the Regional Planning Council to kind of codify some of the specific areas that will be providing support and the a range of the number of hours that you would be looking for. So I'll open it up for questions and we'll try to provide answers.
Hi. I have just something to say. Can you hear me?
We can hear you, yes.
Okay. First of all, Mr. Dunn, Mr. Holcomb, thank you. This is really well done. Are we going to get a copy of this so that we can review it on our own at the same time?
Happy to provide you a copy.
Okay. I'd like to see this. I mean, there was a lot of information, a lot of pertinent information there. And I know you're going through it, and Zoom sometimes can be very difficult to comprehend at the time. But if I or other members, for that matter, would like a copy of this, this is something I think we need to talk about. There are some very good things in here. And like I said, I wish I had something because I was trying to make a couple of mental notes here and writing down some things. But now you say that this money, and let me, 400,000 covers 5 counties.
Oh, no, sir, that was an example on the census. So
Okay.
that dollar amount has nothing to do with what we're talking about today.
Okay. All right.
It was, I guess, a little bit of a victory lap that I was using.
Okay.
To say that
Nice.
we did so well on the census initiative that, pennies from heaven, I guess.
Okay.
That the state trusted us to continue forward. I think the evaluation piece that Jason brings up is critical to this. Whether it's on the transportation planning side, the criminal justice side, or even the land bank side at this point, is we have muscle memory here that predates me, and it goes back to Steve Ernst and Janice Fadden and others. We have muscle memory in that we don't give any federal or state money out without continual evaluation on the results and tracking and understanding continuous improvement. And so you're working with a culture here where we don't end the process the minute the awards are handed out. And that 400,000 is an example of somebody evaluating our results and knowing that we were a good vessel for that federal money to make sure we don't have an undercount in underrepresented neighborhoods.
Then I stand correct. I was trying to write down as quick as I could and didn't want to lose train of thought with you on that.
I'm not the best communicator, so I apologize.
No. It's Zoom for me, It's
Could I request that you remove the screen share
Oh,
portion?
I'm sorry. Yeah.
Yeah. I can't see the whole group.
Yeah.
Yeah, thank you. That's helpful.
Thanks.
So I want to make sure everybody can ask questions and Bill.
I have one, Marianne. Mike and Jason, well done. Really nice presentation. Thank you for that effort. Just to broach what I believe is our reality is money doesn't begin to flow to us, I believe, until October. And perhaps you've had this discussion with Marianne, how in the interim we need to begin working now. Have you discussed financial realities of beginning now without money flowing until October?
So Dr. Gorski, thank you for that question. We are, the county is our largest funder, more than the city of Rockford. And we are a fiscal agent to 6 other government entities. So we are used to the census money comes in, but the IDOT money has not. We're used to cash flow concerns on how other entities pay us as a fiscal agent to 6 other entities. Considering that you are an extension of county government, we have no problem getting to work when you want us to and when you release us to get to work, knowing that at some point the county can backstop any sort of funds, and we can easily wait until October, November, December, January. It's more important to us that the subawards are made from your body and that the money is distributed to the way, the whole reason why we elected to have this referendum and have this sales tax. To us, we'd rather see that process occur, knowing that at the end of the day, the county is our owner. They're not going to let us be insolvent. And so we can figure out cost control at that point.
Thanks, Mike.
I had the question when I spoke originally with Mike and requested a presentation regarding who's in charge, because I think that's a real important issue here. And I was concerned, we have done now today, we're going to be reviewing an environmental scan that Dick and his committee have worked tirelessly on, and it's excellent. So I think of some of what Jason outlined in terms of determining needs and gaps and whatever, we're beginning this process. So Mike, you explained how you view the hiring of a staff or, utilizing a staff member, but how they are not the predominant decision maker.
Sure.
I thought that was reassuring.
Yeah, thank you, Ms. Abadi. And I see Wendy's on, and I know Dan's listening and Paul's on. So, I mean, everybody has their own exposure to some of the government entities that are now part of our organization. WinGIS is one, right? The RMAP, what was considered RMAP is, and what we inherited was that, what I inherited 5 years ago was something where, well, if it's RMAP, that's Larry Morrissey's thing. And Larry Morrissey's in charge of it. And Larry Morrissey, it's Larry Morrissey and RMAP. And that was not the truth. And that's not how the MPO, the RMAPs of the country are operated in every other successful community. RMAP had a 7-member board, and often the mayor of Rockford wouldn't even be the chairman of it. But optically, in the community, that was the association. Such as WinGIS was associated with the chairman's office in Winnebago County. WinGIS has an 8-member board, and often Winnebago County was not the chairman or the chair of WinGIS. What you're dealing with are these multi-jurisdictional IGA-created government units. They're special purpose units of state government. But there's an association in the community on what is what that isn't reflective of the governance model. And so 5 years ago, very deliberately with Mayor Morrissey and Chairman Christensen and Mayor Lindbergh and Mayor Boland and everybody's support, Mayor Chamberlain, that we were going to change that. And we have, and we've stayed true to that. And that is we are a client-driven, almost like the private sector, a client-driven organization. And that our land bank board is made up of people like Gary Anderson and Sherry Geschke, who are not mayors and chairmen. And we report to the land bank board, and the land bank board sets priorities, sets policy, sets fiscal constraints. We adhere to what the land bank board says. Staff does not drive that. Staff does not set that. For transportation policy, the MPO board does. The elected leaders get to fire and hire me, and they make up my executive committee. But at the end of the day, I have a staff member that reports to the MPO board. I would have a staff member reporting directly to the mental health board. I have a staff member reporting directly to the land bank board. That's the only way this Switzerland model works. And that's why I said in my opening comments that we try to keep politics out of the office. And so on something with a high amount of sales tax coming in at a time where the county has needs in many other areas of the county, I think you want to, it's my personal unsolicited advice, you want to depend on an outside independent criteria and selection process at a minimum. And I think we can assist you with that. I don't think we bring that all, but I think we can assist you with that. And so a long-winded way to answer your question, Ms. Abadi, is we have at least 5 years of predicate and history of a number of staff members reporting directly to these government boards that are not the mayor and the chairman. They're appointed boards. They're boards that might be appointed by the mayor and chairman, but they're not the mayor and chairman. So far, nobody's complained.
Oh, I think Dick was.
Oh, I thought Ed was. Dick?
Jason, I thought you did a really terrific job of
Thank
Yeah.
you.
The executive function of a mental health board. And so I really think the issue would be the one that Bill brought up, that we would have the money to be able to together. Because as Mary Ann mentioned, I'm hoping anyway, that the board will move to pass an environment scan today, and that when we develop that information, the next piece that we would need would be to start to have some administrative hours to begin to pull all that together. So, you know, I thought you did a nice job, and Michael, I think you've made your point of what a regional planning board can do.
Thank you.
Wendy?
The thing that strikes me, I know Mike and I had a long conversation, I guess, I don't know, a month and a half ago, maybe. And thank you for articulating nicely, I think, what you do. I think the main issue that I see in the next 6 months is I think this board is well able to formulate, you know, the request for information, sort of the scan of the community. But what we need help with, and will need help with in the future, is sort of the administrative functions of how do we compile all that information we're going to have. And at the same, and also, I think we have discussed recently amongst the board members, the need to do our own internal scan, if you will, to help us come up with our vision, mission, and action plan that's going to drive how we utilize the environmental scan data that we get back. That fair? And I see that as being something that R1 could help us with, help us stay on point and not get distracted, and help us refine the board's vision of what we want to have happen, short-term, medium-term, long-term. So that's the value that I think you potentially bring to us.
Thank you. And just speaking to that a little more, that was a lot of the work I did in my time at Transform Rockford, was taking startup projects, sometimes just a group of champions in the community who were very passionate about something and wanted to see change, but really needed to go through the process of developing some established goals, mission statement, vision. And so certainly would be excited to help the board with that.
Any other questions for them? I don't see any hands up. Thank you very much, Jason and Mike. We will discuss and, you know, definitely get back to you, I'm sure.
Thank you for having us. Thank you.
Regarding next steps.
Thank
Okay.
you very much.
Thank you so much.
Well done.
Okay, moving on to the next agenda item. Dick is going to have to leave us earlier for a doctor appointment. So Dick is going to update us on the environmental scan that he's worked on. Everyone has a copy?
Actually, I don't have a copy. I tried to open the one that was on the 27th.
Yeah.
I think Dick is going to share a screen with us, right?
Yeah, I
Yeah.
hope so. I hope it comes up.
I'm super impressed you can do this, Dick.
There we go.
Yeah, boy, I am
All right.
too.
Okay. So folks, I mean, yeah, there were some problems with the link coming back to Google Docs. So I shared with people who asked, I had a Word, I copied it on Word and I can get it to you, okay? So
All right, that's great.
speaking over it, so folks, what do you think? What this is, as you can see, this is, we built it off of the community support system. And that was that monograph I sent out to you some time ago. That still represents best practice, even though it's an old document. So the plan for this would be that if today you would pass this as our instrument, it would go out with a letter from the President, Mary Ann, along with a copy of that monograph on the community support program. That would give people the definitions of what it is and the taxonomy for what it is that we're talking about here as we lay this out. Then the last part is obviously what you see in front of you, and that is, you know, we've tried to add all the pieces to it so that it gives us the data related to each of the points for this array of services that make up the community support program. So feeling that this would give us that baseline that we want to know what's happening in the community and allow us then, as Jason was mentioning, either, you know, to develop our request for proposals to shape the system the way that we would want. So that's the essence of what this is about. Questions?
Dick, do you want to scroll all the way down for us with this?
Sure. One of the pieces that you know that Jay wanted to talk about was particularly, and it's so relevant, obviously today, and that was the whole kind of thing and about what do we do with education and where does that fit in, and there is a piece for that. We get down here on family and community supported education for the community. I'll just stop on that for a minute. So this is the one that so in addition to the points that are being made regarding clinical services, we have then supportive services. And for example, law enforcement would come here, as you see, would allow us to make offers to be helpful in terms of staff development, multiple ways with various agents, law enforcement within the county. Last night there was an announcement some of you may have seen on Chicago Tonight that the governor has put $2.5 million out, which is not a lot of money, but already for mental health issues related to law enforcement. So I mean, obviously we want to do our part. We want to be creative. Okay, so that's what you see as we go here. The combination between direct clinical services, we're talking about kids and adults, we're talking about mental health and addiction. I've done some vetting of this with providers to people in each one of those areas and ask for their input regarding this. And so what you see is the end product comes as a result of conversations with numbers of people. So that's this would be to get again our fundamental base of information across the community about what's going on now and where the gaps are.
Dick,
So
you
Dick-
said that if we, I'm sorry, you said that if we passing this today, if I heard you correctly, you said it would then go out. Did I hear you correctly? Where would it go?
Well, Bill, you know, yeah, if the board accepts this as the basic document, we have a couple of questions that immediately come up. One of them is, what format do we share it in the community? Okay, in other words, do we do hard copy? Do we send it out as paper? Or do we take the time and we happen to have some expertise on the board through Danielle? Do we use an instrument or a product like and turn this
Survey
into
monkey.
whatever? We turn it into a digital form and send it out electronically. And so that would be a choice that we have. So that's what I mean by that.
Okay.
The other thing is, and Danielle, you might want to speak to this, and that is the database that you have that we would be using.
Well, I think that it would be beneficial to do like an online survey, because then we're saving cost on paper, on mailing, on all of that stuff, and it's way more user friendly, I guess, for people to just send it back and do it when they see fit, right? Instead of writing it all out. And then I kind of borrowed our like service provider document from the children's mental health service thing that we're doing through NICNE, because I think that it was a pretty good scope of private, public, and nonprofit providers of mental health, not just for kids, but for adults too.
I saw Ed, you had your hand up before.
Ed, you have a question?
Yeah, I can't see anything. I'm assuming you were sharing a screen or something, and
Yeah.
I couldn't see it, nor could I open up the document. But based upon what I heard you say, and I just had a quick question. You made mention of the direct clinical services and the various other things. I'm still a little bit unclear about. I think I heard your question in terms of what format we want to release the information in, but I guess my question is, why are we releasing it right now? I missed that part.
This would be the base. This would be the base, Pastor. This is what we want to get to, assessing what's in the community. Who's offering what service, where, and then all the dimensions and capacity related to that. So this is that first line that we want to create, develop a base of information that tells us what needs are, how do we do our priorities? How do we spend and make priorities for funding for either services and or education to do that.
Okay, so I think I'm clear on that. And then Danielle, if you could repeat what you were saying about the online piece that you were talking about and how that would be more user-friendly. Are you saying that we need to make sure we're casting, and forgive me, I don't know if I'm just zoomed out today or or I was just clicking, trying to find what Dick was showing us, that I missed some things. The online piece that you were talking about in terms of survey and the work that already been done, or that you had gotten from other organizations, that was to further make sure that we've cast a broad enough net to catch everybody, or what were you talking about with that?
So I took basically the contact list that we gave a different survey to, and it just really like entailed all the public, private, nonprofit providers. So I thought it would be a good idea to reach out to all those people again. And I thought it was pretty inclusive of most places.
Okay.
And the reason I suggested doing a virtual kind of survey was because it all stays in one database, and like you can export all the data, and like you don't have to go through and type out everyone's answers that they have written a response and mailed back. And I just think it will save us a lot of time, really.
Okay, then. So I have a question. I have a question because I was not as zoomed out as I thought. What I thought Dick said is what he in fact actually said, and what I heard Danielle say, in fact, is what she. So since I'm actually in reality, I guess my question then becomes, because I heard Jason say something, has there or is there any means that is already out there by which those who are receiving the services have been able to give their input as relates to the fidelity or their perspective of the services that are currently available? And the reason I say that is because I've been involved. I've been doing collective impact for a while myself. Me and Bill have been working on some things for a while on the educational piece, and I've been doing some stuff on the community piece where very often an agency, organization, or person might have a name recognition, but then if you ask the people who actually engage that agency, that group, or that person, they'll say the name is not necessarily reflective of what they receive. And I think that would be useful to know, lest we be perceived as promoting, when we're just actually doing an environmental scan, we're just saying, hey, this is what's out here, and let's talk about where the gaps. That's what we're saying. I don't want to be seen as in the community saying that, hey, this is a legitimate thing out there, when everybody in the community knows, yeah, they're taking a lot of money, but they're not legit. Or yeah,
but this is different. What we're doing with this scan, or what we're trying to do, is if you saw the document, it really goes through the questions. When you saw the circle around the client of all the services, that's the community support model. And so we're taking each spoke, from the crisis intervention to the housing, to the rehabilitation, to the vocation. And we're asking the same question to the providers. When we send this survey out, we're sending it to providers, private, and to consumers receiving it. Does your agency provide the service? Do you provide the service for people suffering from mental illness and addiction? What are the hours of service? On and on. Do you accept Medicaid, Medicare? Does private insurance have payer limits? Does provider offer low-cost options? So we're asking about every service in the community service model. We're trying to get a feel from the entire provider community as to what's out there now, so that when we get the results back from the survey, we can see the gaps. We can see who's providing, who's not willing to pay for it. Even if it's being provided, they can't really provide it because insurance won't pay for it. These kind of things. So I think
I understand that.
But okay.
Again, I've done environmental scan.
I have a question.
If I can finish my question first,
Yeah,
please.
sure you can.
I understand that, because again, I understand what an environmental scan is and what we're trying to do.
Right.
I'm asking, is there anything in there? Because I'm part of the community that very often cannot access resources, or those resources are underserved. I'm
Sure.
asking if there's anything in there, and if there's not, there's no problem. I'm just saying this is a point that we need to be aware of.
Mhm.
That we're just doing an environmental scan so we can show, okay, here's the process we're going through. We got to do this first. We're going to take a survey, and here's where the gaps are, and all these types of things. But I'm saying at the same time, it seems to me, and even if we can't do it, there has to be an acknowledgement that somebody at some point needs to talk to the people who are being provided the services, because there might be some service providers, or there might be some service providers that we need to be aware of in terms of what their community is in the community. At the same time, we might be missing some that people are considering as service providers that maybe we're not highlighting.
And Ed, I agree with you. And I think that is the next step.
Yeah.
And I think maybe that's where R1 comes in potentially, because then they could go to, let's say, Aware Center and talk to clients and say, so what are your needs? How are they being met? You know, go to Children's Home and Aid Society and say, so you're a consumer of services, what's really going on here? So that then we have a more full picture of who claims to do X and really is only doing half of X. Is that?
What you're really outlining, Ed, is the process that goes on around the request for proposals. That becomes the time and the place where all the quality issues that you're raising can be asked and talked about. What's the reputation of the agency that is looking for our money?
Yeah.
What level of integrity do they have within the community to deliver what it is that they say they want to do? And the other part of that, again, is the part that Jason mentioned of like evaluating what we put out on the street to make sure that each and every person, or I'm sorry, each and every agency that we are working with comes to understand that if you take our money, you better do and live up to what it is that you said you were going to do. Otherwise, we take the money back.
Julie? Julie?
So what I'm seeing, this information that we're asking for in this survey, wouldn't it be information that we would then use for our strategic planning?
Yes.
Because once we identify the gaps and redundancies, then we need to determine, and that kind of gets to what I hear Ed saying, that then we have to determine, okay, what is our, you know, in addition to our beliefs and so forth, what are then the strategies that we need to address as a board?
Right.
Well, that's kind of what I'm seeing, this information being part of that, part of what's going to inform our planning. Is that accurate or?
Yeah, right. Because what we're using again is the strategy was around that community support program, Julie, in terms of picking out what it is that we want for a basic array of services within the community. What's important to people that we get information back, and then how do we best move forward to support, help out. We can augment what's already going on, or we can add to what's going, put something new in place. So it gives us all kinds of options.
Linda had a question before, so because she's not visible, I forgot her. But
Oh, here I am. Thank you, Mary Ann. My question, I think that it's very important we do an environmental scan, and I think all of the comments are very pertinent to this. I guess I'd kind of like to go back to Region 1, though. If we have the opportunity to bring them on board to serve as, let's say, an executive director, let's just use that term right now. I personally feel that perhaps we should do that first and then let them send out the environmental scan so that we have consistency in how we're doing this, what we're looking at, and how one step leads to the other. This seems, I appreciate everybody's expertise. This seems overwhelming to me, though. I looked at the environmental scan. It's very long. It's very thorough. To me, if we're going to hire Region 1, let's hire them as quickly as possible and have them start taking this on. Mary Ann, you and I had talked before about the expertise that Jason brings to the table. To me, this would be, I think we would gain a lot more by making that decision and then getting them to start working on this instead of trying to do something ourselves first and then put those pieces together.
Good point.
Julie?
I would agree with that too, because then they would also, if I saw that one of their things to do is strategic planning. So then they are going to help us fill in what else do we need in order to do that strategic plan. The scan is important, but there's also other information. And I think that they should, if that's what I'm understanding them to do, they will then help us pull that information together, let us know what it is, and then help us develop that plan from there. And I would agree with Linda that let them do the scan, take it from here and do their thing. Based
Bill?
on,
I'm sorry. I
No.
didn't know you weren't finished. I'm sorry.
no, I'm good.
Bill?
I have like 3 things. Now my challenge is, can I remember all of them? I think the first one was to commend Dick for, and whoever else worked on all that. It's phenomenally robust. I see it as an inventory of what's present in the community, just another word to use. And I want to just, I agree with Linda completely. I think if we're going to use them, then having a unified sender outer of information and a receiver of information from the beginning reduces chaos. And I just have to say for a second, I worked with Jason at Transform on the steering committee. He's a very talented individual. And you all on this board have so much more experience than I do in the mental health arena. You're going to be able to assess proposals. You're going to be able to evaluate things based on your knowledge that you already have. But to have him there with his additional expertise just adds one other voice of expertise that I think can be valuable. And I think my last thing was to support what Ed was saying. And maybe what I hear you saying, Ed, is maybe particularly before an award is made, after we've scanned and coordinated it with a strategic plan, run it through all those filters, maybe before an award would be made, that real boots on the ground analysis of the individuals who utilize those services, because we all know that things aren't always what they appear to be or what they're promoted to be, which is, I think, where you were going, Ed.
Right.
And to hear from the real utilizers of service, what their experience has been, just gives the ultimate decision and the public awareness of that much more credibility, that we've gone to those individuals and we've confirmed what we believe they can provide. I think those are the 3 things, Marianne.
Well,
And-
you summed it up beautifully. And
Yeah.
I have to say, I agree with every one of the comments made, because I actually have a history with Jason, because I hired him out of undergrad. So he worked for me at Janet Waddell Center for 6 years. And he's gone on to greater things and done some remarkable work in the community, but he is very client driven. And to me, nothing is more important than to have, that client in the middle, because that's what we're trying to do, is to get the dollars to the people that need it the most. And I think his expertise, his experience with, being able to analyze data as well as just synthesize, and I think as our board is developing, this would give us such a leap forward, in my opinion. Jay Ware?
Oh, yes. I was wondering if everybody saw my hand up, but.
No, I didn't, but I saw you were highlighted. So that's,
Okay.
I'm trying to keep up.
I think the general things that I wanted to say is when I look at the scan, and it really does have this emphasis on the people who are currently using the mental health system in some ways. I've got a child that's drug addicted, so I'm going to a place or getting services, that whole thing. That, for me, it still leaves a whole lot of the community out. And I tend to think that this scan is perfect for those clinical sorts of things. Dick mentioned I've been talking back and forth on where to get the criminal justice system involved in it. They almost need their own complete different scan, because they're not going to be asking questions like how many clients are served daily, and things like this. Their whole structures are going to be a little bit different. I don't even know that they need a whole lot of our money, to my way of thinking, the way I've looked into it. But it's an entirely different conversation. And I'm very afraid of putting something out there that the community looks at and says, they're not even dealing with the police, and I'm real concerned about that. I think that somewhere in our stated goals, the police need to know that we're going to come and talk to them. And it's not going to be just a question and the answer. I need to find out from them, where do you guys want to go? Where could you go if you had a little bit more money? What could you do? And it's a different process, but I do think that's what this board should be tackling. So I don't know. I'm trying to figure out when that gets addressed. It shouldn't be addressed the same way that the Ware Center is addressed, or, my daughter's psychologist or something it's a different conversation. Now, I think the mental health board should be dealing with that criminal justice element and having the gravitas of this committee saying, hey, look, chief, let's sit down and talk. What do we need to do? Is this the forum for that? I think it should be. That's why I think I'm here. So I'll shut up.
Ed,
So Danielle, thank you for sending me the scan. So now I've looked at it, and again, I just want to reiterate, I think we're doing what we said we were going to do. I just wanted to say that what I was trying to get at is that the point of the survey is to find gaps, if I understood correctly, and among other things, but one of the things is to find the gaps in services. And all I was trying to say was the people who are trying to access services might be a wealth of information from their perspective in relation to what the gaps are. That's what I was trying to get at. Now, all the other things that everybody said, I was trying to say, that's true. I'm saying all of that, but right now, we're at the part where we're trying to get the lay of the land and find where the gaps are. That's my understanding where we are in the process.
Right.
However else we do that, that's fine. I was just suggesting that sometimes those who are closest to the problem are closest to the solution. And if there's a way, there might not be a way, but I'm just positing that, hey, somehow or another, it seems to me that those who access services or who need to access services, maybe somebody ought to ask them, where the gaps are, as opposed to if you ask Taco Bell, Wendy's, and McDonald's, what do people need to eat, they'll say more of the stuff that they're serving. But if you ask hungry people, what do I need to eat? Maybe they might say, you know what, I'm tired of burgers and tacos. Can somebody give me a salad somewhere? I mean, that's a whole different.
so true. I agree with you.
So if we're talking, like Julie said, about, let's say, retaining R1, maybe that's one of the things we say to R1 is, as part of this environmental scan, not only do we want you to look at agencies, but we want you to maybe have a portal where consumers or consumers' families can come in and make comment on what is missing for them. What's the barrier to obtaining services?
Right.
Those kinds of things. And I think that's where someone like R1 is going to do a cleaner job, because some of it, I think, is PR. We need to get out into the media and say, we're looking for community input from agencies, from consumers, from families. What's missing?
Bill.
I agree with this wholeheartedly. That was the intent of my comments earlier. Let me just, because it just popped into my head. Having been a part of a large organization, just as a caveat of caution, a large organization for many years that did and does extensive customer satisfaction surveying, the credibility of that, so that you don't get caught up in anecdote, begins to revolve around the numbers of respondents. I'm trying to be gentle in saying that, and maybe Dick, in the environmental scan somewhere is, does your organization do, well, obviously quality measurements? Do you do customer satisfaction or whatever? I hate that term, customer satisfaction. Whatever, do you survey the people that you serve in some fashion or form in order to get the largest possible number? Because very honestly, you can get anecdotal information from individuals that skews what is truthfully happening with the service that's being delivered. And I just offer that caution because
right,
in our organization, we did everything we could to not to disrespect the anecdote, because every anecdote can be, in and of itself, can be crucial, and it can give you information you need to hear. But the overall performance of a given service may not be reflected properly in one or two comments.
right.
Agreed.
What-
Let's see, who was first? Julie, you were first, and then Dick.
I guess I see at this point, a lot of our conversation revolves around what we want to see as a board happen. And I think one of our pieces of discussion today was to determine, do we want to hire or however engage Regional One Planning Council so that we can start doing all these things. And I think that's really kind of where we're at this point, is to say, we all are making some really great points. Now we have to have somebody go out and do all this. And I think that that's kind of where we're at.
So
That's right.
is the board all on the same a plane, I should say, with Julie's kind of pushing us towards, are we going to make a decision about R1, or do we need to just take their next step kind of suggestion where we would find out more of the financial burden? And maybe that's where we should go. If we all feeling, comfortable with what we heard today, we could at least get some financial information from them in terms of their expectations. I'm throwing that out there.
Marianne, do you think we need a motion for that? Because
Wait, that's what
I
I'm
think that
asking.
you're right.
That's
So
what I'm asking.
Okay, I will make a motion that this can't be, okay, first of all, I'm going to suggest that we table the environmental scan, but then I'm going to make a motion that we, as quickly as possible, find out what the financial obligation of using Region 1 would be and find out how quickly we can hire them. Again, everything I think that everybody is saying seems to me something that Jason indicated that they can do for us, right? I mean, they can be basically our executive director, which we all kind of agreed based on the document that Julie and I had disseminated last time, that we need, you can't see my air quotes, somebody who does that. So if Region 1 can be that person, then I think that will start streamlining what we're doing. So I make a motion that Marianne be empowered now to go understand what Region 1 would charge us for their work, and perhaps even bring us back a proposed contract then.
Julie?
I think that just as a point of order for Open Meetings Act, since it's not a voting item or a motion on here,
Right.
I would feel comfortable if we took consensus that you go do that. And then we come back with the proposal with a voting item at the next meeting.
Right.
We need a proposal. I think that's key.
Well, do we have
I would
consensus,
second the
I
motion.
guess,
but I think
to
it would
move forward to get that proposal?
So if we need to, I would second what Linda said, and then I don't know that we can take an actual vote, but we can take consensus.
Can we, Paul, take an actual vote when it's not?
I thought that the motion was to just get more information.
Yes.
That's the way I took it, and which I didn't take as being a final action. Which is
Okay,
what the open meeting requires. That's the way I took it.
okay.
But either way, I mean, the consensus does the same thing and covers your bases.
Well, since we have a motion made, do we have a second? Julie?
Yes,
Okay.
a second.
So the motion has been made to proceed into another discussion with R1 regarding a proposal and bringing that back to the board for the next meeting as an action item. Okay, all those in favor?
Aye.
Aye.
Any opposed? Same sign? Okay, then I will contact them. And Ed, did you have your hand up? I thought, no, okay.
Can I say something?
Sure.
Yeah, I'm over here being the quiet mouse, I guess. But here are some things that I've kind of thought about with these guys. And Dick, this is going back to your scan. It was incredible. It was very long, and I'm looking at it going, it's a little overwhelming at the same time. But I wondered, there's what, 12 of us on this, or 10, 12 of us on this committee? And you know, Jay Ware, you and I both have kind of an interest in what's going on with criminal justice and law enforcement. And I'm thinking if this Jason or this Mike and Jason get all this information, how's it going to be disseminated? We understand each and every part of it. If those of us who have an interest, I'm going to use Jake. If you don't mind, I'm going to use you as an example along with me. If we would get that information and then we can understand it and present it. I think sometimes it comes in as too much and we just kind of, okay, that sounds fine. I think there's got to be, some of us got to be split up into committees that are overseeing that to make sure it is being implemented and the monies are being spent wisely. It's too easy to kind of just like, yeah, I'm glad we got these two guys to take care of this for us.
Oh, no, they're not, Terry, they are not taking care of the budget. They're not.
No, I didn't say not about budget.
Yeah.
I'm talking about.
No, but and the decision as to where the money goes, you think that it's an oversight piece of
No,
it.
I'm just thinking that those of us who have that interest, and again, Jay, forgive me, but he and I both are on a criminal justice reform. We're both in the law enforcement type of situation. Maybe we should be overseeing that part of it. And then others on this committee could be, or on this board, could be overseeing other parts of it too. So that way, when it comes together, we have a much firm understanding to present it. Now, if I'm out of line, I'm out of line. But I just think sometimes we're just need to hear it more get it firsthand perspective.
Okay.
I'd rather get it firsthand.
Julie?
And I think, again, that is really important, but we need to have our plan first. And then that would be part of the plan as to who's going to do
Right.
what. So before we do that, I can see that you have a real passion for that. So that would be certainly something that once the plan is together, and your committee would go off and do this. But our first step right now, we have to have the plan. And that's what I think we need to have the planning council help us do, is to put that plan in place. And then I would go off and, you know, my passion is education. So maybe that's where I might go off and get interested and do some of the groundwork.
Sure.
That's where we need to first have a succinct plan in place so we don't go off into 85 different directions. So that's how I see where we need to be right now. And I think we're taking a good step toward that by having the Regional Planning Council give us a recommendation or give us a proposal of how they would help us do that.
Ed, you had a question to the group?
I do, but
Trying to get clarity.
The
No,
oversight, you asked what's meant by oversight?
I just was trying to get clarity from Terry what he meant by oversee, but actually Julie has already sort of made the question moot.
Okay. Dick, since you had the scan, do you have more to say about this since that's a part of the agenda we're still on?
Yeah, the reason that I was willing to really put the time in to do this, and that is when going back to the committee where we even were selling this whole referendum, when people asked, what would you do if you got the money? Our answer was we would go toward implementing and putting the community support program with all that means to shape an array of services within the community. And so my interest in developing the scan was to just simply make the point that the community support program as a conceptual model will work. It will give us the basic information we need in order to move forward, like with the point that Julie is making about put the plan together and we can go ahead and do this. And so that's why I wanted to bring that to you all to have see that. And so even if, and even to, make a motion or approve that we have this available, okay? That would be something that someone like Jason or someone else has the capacity to move it forward, share it within private, public, and not-for-profits within the community, and help us get the information we need in order to be good planners and to be good providers within the community. So that's really all that's there.
Bill?
I'm looking again at the scan, Dick, and everyone, and I'm just going to restate what I said before. And looking at it, I guess I just throw out again for clarity. I'm wondering if part of it could be, I'm thinking of potentially the health system I worked at that has an inpatient unit, has an emergency room. Let's say they're applying
Right.
for something.
Right.
Is it unreasonable to ask any agency if they collect quality data on their
Yeah.
performance, which
Right.
would include client satisfaction data?
Yeah, we could add that. I mean, that really very simple. I mean, I can edit that and we can do it now.
Well, it's just my thought, Dick, but I wonder if
Yeah.
that makes sense to everybody.
No, that's a good thing, because most, like, as you well know, Bill, from accreditation, I mean, if anybody is paying attention to those things, they have to have that these days.
Exactly.
You have to show that you've talked with your customers to see, if you're doing for them what you said you were going to do. So easy piece to relate to. Yeah.
Great.
And the same thing, with Jay and I have, had a couple of conversations. Jay, I think it's a matter of trust with where we are, because I totally agree with where you want to go with that around the whole issue of law enforcement. But I just simply see if we got basic information now, we can do the things that you're concerned about. If there were any RFP, if there were any requests for proposals coming from law enforcement, we get a chance to shape it with all the quality and get the monitoring back and talk about what it is that we want to do and what the goals would be. So, so, again, that's such a critical part of the community, and the way that people access services, because one of our goals is to keep people out of the mentally ill people out of jail, and addicted people out of jail. So it's like, again, those, what we then want to do is to have with the police be comfortable with, dealing with people's symptoms and not get carried away.
So Dick, what I hear you saying is that you would like to have a motion to approve this environmental scan with the addition of what Bill wants added.
Right.
And that this scan then could be put forward with the help of R1 if we hire them. Is
That's
that,
right.
am I
That's
understanding it correctly?
That's exactly right.
Great idea.
Well, so is anyone
have a
willing to
comment.
make that motion? Jay?
Comment before we go. I hear what you're saying on trust, and it's not that I don't like you guys or I don't think, I respect everybody, but it just does not feel to me the idea that we're going to send this scan out and they're going to get some kind of a request for quote from the police department. Oh my gosh, I don't even know if the police department's thinking like I am yet. I think Terry and I are in a place where I think we need to start opening up conversations with them. I mean, what you're going to get back from them is maybe not what we're looking for. And here's what I would like to see us do. I would like to see us go ahead with this scan in whatever way we want to do it. But let's realize that the law enforcement component is going to be drawing in different people and having a different conversation. These questions that are on this scan are not relevant to the police department. I just don't see it.
But they really were not intended to be.
I know.
I mean, this is to find out current services. And actually, the jail does provide mental health services. I mean, I can tell you that firsthand. So there are screenings and services in the jail. They could answer whatever part of it. This is not all the information that this scan will help us gather is so that we can become informed as a board as to where the needs are, where the gaps are, what programs tend to be problematic, because even if services are available, but only for a certain population, you know, that's what we need to be looking at. And also, I think that you're right, Jay. I mean, this right now, it's even more of a focus than ever, the criminal justice and police. I mean, we're watching it and this is a national focus now for us going forward. And you can't separate mental health from the population in the jail or addiction from the population in the jail. I mean, all the 41 years that I worked in mental health, I mean, I was in the jail as much as I was anywhere, to tell you the truth. So our population of people we want to serve many times end up in that jail.
But
So
Mary Ann, the population Jay is talking about, or what Jay is talking about is different. What because he and I have been talking this month, and what we talked about was how are the people who are responding to people with mental health and addiction problems trained. This scan of services doesn't address that. And maybe that's a different scan, but I think it's reasonable. You know, how are teachers trained? How are emergency room personnel trained?
But
How
as we go back to Julie's point, we have to get a plan. We can't go off in 30 directions right now.
Right,
we have to
right.
Get information and then you develop a plan, priorities. Danielle, who never raises her hand, is willing to participate.
No, I just wanted to say, going back to the strategic plan kind of idea, that there definitely should have to be a legislative advocacy piece to this. And I think that's where Jay and Terry are bringing that to our attention. I mean, that's a huge part of this. It's not just about dispersing money to people. It's about making like systemic changes, right? Is that what you guys are saying?
That's true.
Yeah.
And I mean, the scan is just one part of
it's the system.
Bill.
Maybe this is a question for Paul, but I'm thinking of what Jay has been saying. I would hope our hands aren't tied by a scan or an RFP process, I would hope. So it wouldn't mean, would it, that we request proposals from agencies that provide service, but as Jay said, we're talking about law enforcement and a different subset of needs to address. There wouldn't be anything in a process like that that would prohibit us from proactively going to, let's say, law enforcement outside of an RFP process, would there? Does that violate anything? Well, you said you were doing RFPs, you got all these RFPs, but now you've got this money and you're not necessarily just awarding this money to people who give you RFPs, you're directing funds in a different direction.
Right, I don't think there's anything that would prevent you from doing that.
Yeah, we could do that, Bill.
And maybe that's because I think Jay's point is, you know, if you look at the scan, you know, sure, I would see exactly what he's saying, but as a group, we could say, okay, we can accept all these proposals. And then there's this other subset of who really are providers. They may not view themselves as providers, but in essence, they're first responders. And,
right. And there's training issues, you know, I mean, there's all sorts, it's got to be expanded beyond, you know, just the services, because and that's why it's so important that we develop our priorities. And just getting a base, that's all we're doing, is getting a framework of information. I mean, there's no restriction as long as it's going to benefit people with mental illness and substance abuse.
And we have the money to do it.
There's great extensions to that. So
Didn't mean to open up Pandora's box.
Not at all.
Oh, it's
Hey,
important.
we need to have these kind of conversations, I think. So,
Well,
well,
that's the elephant in the room right now. Oh my gosh.
yeah, no kidding. No kidding. So Dick, getting back, so do we have a motion or to move this environmental scan forward or that, yeah, is there anyone willing?
I make that motion.
I'll
Second.
second it. This is Linda. I'll second it.
Okay, so we have the motion to approve the environmental scan with the addition of questions for customer satisfaction
Right.
or consumer kind of input regarding the services that they received.
Right.
And so we
And
have
any quality measurements that are
in
done.
any, okay, in any quality
Right.
measurements.
Got it. Okay.
All right, so we have the motion made and seconded, and do we have discussion, Julie?
Yeah, is this then going to be held for the kind
Yes.
of council to likely do if we decide to go with that?
Yeah, oh, definitely.
Right.
The expectation it would go to R1. then.
Right.
Okay. So all those in favor?
Aye.
Aye.
Any opposed? Same sign? Okay, the motion passes. So Dick,
Mary Ann, I have-
okay, you have to go, I know. The ordinance
Thank you,
piece of
Dick.
it, can Wendy brief the group on that, Dick?
Yeah, I can.
Okay, wait, I'm gonna just move down. On the agenda is a strategic plan discussion. I don't think we need to have that at this point because if R1 gets involved, unless somebody wants to, yes, Julie.
Just one quick question. Would we want them to address that as part of their proposal as to what that would look like?
I think that's a good idea.
I think
Yes.
that's what our next step is, and that's one of the first things I'll have to do.
I think with the research that you and Linda did, it was recommended that whoever is going to assume the executive director responsibility, that they should be involved in the strategic planning. So I would think that made sense. So I can include that in the conversation and the proposal with them, that they should include it for pricing. Okay. All right. So any other questions about that? Comments? All right. The other matters is another agenda item. So Wendy, first of all, was just going to inform us about our insurance status at this time as board members. So Wendy is our advisor.
Well, Paul and I talked about whether we had any kind of liability insurance, and the answer is no. And I reached out to Kathy Pomahawk, who's the executive director at the Advocacy Center, Carrie Lynn. And when the board there was in a similar situation, they actually, through her husband, who's an insurance agent or broker, they developed a special policy to cover their board members. But I think, and maybe Paul can chime in, the other option would be to go back to the county board and ask that the mental health board be included, be indemnified by the county board for whatever issues there might be. But then I was also noticing the R1 proposal. It looks like they are in a position to provide some liability insurance. So
should I include that?
I think, yeah, you probably should ask them what the range of services is and ask them specifically if they do board insurance. And I don't know what the cost is. Actually, for Carrie Lynn, I want to say it costs us about $1,500 a year to cover that for our not-for-profit board. The governmental board is a different issue, though. So I think we need to think about this because technically, theoretically, we could be personally exposed to liability. Let's say the money isn't, I don't know how, I don't know how that could happen, but we want to protect ourselves. So
Any,
anyway,
any questions about this?
I'm a little surprised we're not an extension of
I know.
the county. But whenever we find out, let's find out what the limits of it are too, because they come with different limits, obviously.
right. And I think the simple answer probably is just at some point for us to make a request of the county board to include us, to indemnify us as a subdivision of county government. Paul?
Right, I think the Community Mental Health Board would have to get added as an additional insured under the county's policy. And I don't know how difficult that would be. I mean, it's kind of up to the insurance company, how much, or what that would involve. It doesn't seem like it should be that big of a problem to do that, but it does need to get, it's not an automatic thing, obviously. So, and I mean, I think R1 probably has the same type of thing, that they have some insurance for various agencies that could get, the mental health board could get added as an additional insured. So I would suggest asking them to when you talk to them.
Okay. Julie, did you have a comment? Julie?
Just going to say, what do they do in the other counties that have them? Have we looked at that? Like McHenry, we've looked at their stuff.
I did not ask about the insurance.
But where they're actually 708 boards,
Well, it's
that's
different.
a different animal. They are actual line items on people's property tax bill.
Okay.
It's that we aren't. We're sort of this hybrid creature.
Okay.
So we don't fit clearly. So if the county chooses, they can explicitly say, oh, yes, you're a division of us. But I think we have to make the ask.
Yeah. Okay. Thank you.
All right, and moving on to other matter, the last matter is the ordinance. And did you just want to inform people about what we know and trying to accomplish with an ordinance?
Sure. So I know Dick and I and Paul have been talking about the need to link our board with the revenue that's coming in under the property tax. And short of, I'm sorry, the sales tax. And short of going back to the legislature right now, which ain't gonna happen, and getting the state legislature to clean up the legislation that they passed that allowed for the sales tax, Paul has drafted a couple of different potential ordinances that would either allow the county to enter into a contract with the mental health board for a period of time, so that it's clear the aim of the referendum was to get revenue to be monitored and distributed through the mental health board. Still subject to approval by the county board. We haven't evaded their oversight, but it would be clearer that we have the authority to function, to expend this tax for the benefit of mental health and substance abuse purposes in the county, and try and create a better link between our board and that pot of money. Because the next question is a political one. When do we do this, and how do we build a coalition who will help us get this passed at the county board? Because I don't think they're gonna like it, frankly. And did you get a copy from Dick of the proposals, a couple different?
I did. I have not responded to him. I've just been a little bit tied up this week, but I'll get back to him within the next 24 to 48.
Yes, and actually Dick was going to ask permission today from the board. He asked me because he knew that it's his wife had a doctor's appointment he wanted to be present at. And he was going to ask for a committee of Ed and Wendy and himself to, review the ordinances because Paul gave a couple of options and then bring back to the board their discovery so that if we have to approve moving this forward, at least we would have a committee that vetted this. So that's what he was asking. And as chairperson, I feel that that committee is 2 lawyers and a mental health person. I think it would be vetted thoroughly. So if there's no discussion or opposition, I would just let them review the ordinance. So that's what I'm recommending. Okay.
Sounds good.
Okay,
All
okay.
right.
So we'll talk and with Dick and, okay, we'll get to
That
there.
sounds
Okay.
good. So are there any other issues to be brought forward from any other?
I just mentioned,
Sure.
good. Just make sure that you're using your county emails, I guess. I don't know, just for the FOIA issue. Dan said something.
Yeah, Dan, when he first came on, wanted me to know how important it was for all of us to use our county emails. Otherwise, they may, if anyone needed to get information and you're using your private email, then that's going to be, subject to FOIA. So just a reminder. Julie had to leave early. That's all if I'm delivering. Oh, Danielle, you have something.
Yeah, I was given the information to log in and start creating like our webpage. I don't know if anyone has suggestions for what they want to see on there or not. Should we put little like pictures and biographies of everybody?
Oh, that's a cute idea.
But also, like, what kind of resources do we want to share?
And I just want to add that Dan Majors, as well as Julie Rogers from the clerk's office, has graciously offered to help us create our website. So, the county. So I'm very happy about that. I did a summary of updates for our board to be published in the NAMI newsletter going out to, how many members of NAMI are there, Danielle?
200.
Yes.
But also it goes out to more than that too, so.
Right. I just really basically introduced all of you and let them know that we passed bylaws, elected officers, and we're creating a website soon to come. So.
And I'm wondering if we shouldn't be thinking about developing some crisis resources, because now we have 2 very critical things going on in our country: the pandemic, which people are freaking out about, but also now this justice issue where people are, trying to make change, but it's creating.
I know, but I think that's right
Is it
now. We gotta
premature?
get our plan together.
Okay.
And
All
so
right.
I think we've got to prioritize what,
Okay.
what needs to happen first. I couldn't agree with you more, but let's take one step at a time and move forward. So can we set another meeting? I know that I tried. I want to apologize for last week. I sent everything and I had all the emails confirmed, but anyhow, now I know who I'm going to be dealing with, and this won't happen again. We won't have to reschedule, but I know Ed cannot do it on Thursday and Friday. So Wednesday seems to work for everyone. Should we make it next month for Wednesday? Let's see.
That would be the 1st.
Yeah, 1st of July. Yeah, my gosh. It's kind of freakish, July.
Hmm.
Does that work for everyone? Or would you rather go 6 weeks? Or, what I would like to do is go a month, because if we get to resolve this R1 issue, and so we can have them on board, the sooner, I think the more coordinated everything will be. So does
We're
that
still
work?
new. We're
Yeah.
still- So
I
we,
agree. That's my thought process, but I don't want this to become overwhelming for anyone. So we'll say Wednesday, July 1st at 2:00.
That's good.
Okay.
Yes. Could we just make this the first Wednesday of every month at 2:00?
I would not object to that. It would be so much easier for me. Setting the meetings now and getting the agenda to the clerk's office on time and everything. How would that work for the board?
sure.
I would be all right with that.
Okay, that sounds great. I don't see anybody in opposition, and I can check it out with Dick, and Julie Morris had to leave early too. So, okay, so is there a motion to adjourn?
Yes.
Terry, okay, thank you. Is there a second?
I'll second.
All in favor, say aye.
Aye.
Okay. I don't-
Thanks, everybody.
Thank
you
you.
so
Everyone
much.
be safe.